This video, we will be looking at 3 biochemistry clinical questions. So before deciding the answer, you can just pause the video and think about the solution and come up with the answer, or else you can continue ahead to look at the solution. So the first case here is patient presented with the following symptoms: deteriorated vision, tingling and numbness, pain and spasms, weakness and fatigue, balance problems, and cognitive problems. You advise the patient to take some tests. One of them were a cerebrospinal fluid test. Upon the arrival of the result, you notice that CSF phospholipid levels are significantly high in this patient. What is the possible diagnosis? So here, an important point to note is that all the symptoms of the patient are related to neurology. And the test we asked the patient to take was a CSF test. And in the CSF test, the phospholipid levels were significantly high. So if the phospholipid levels are significantly high in the CSF, then that means those phospholipids have been destroyed in some other tissue. And that is the reason why it ended up in the cerebrospinal fluid. So this is multiple sclerosis. So multiple sclerosis presents with high levels of phospholipids in the CSF as a result of loss of ethanolamine plasmalogen and sphingolipids of the white matter of the brain. So that is the reason why you had high content of phospholipids in the cerebrospinal fluid. Now, here are the common symptoms of multiple sclerosis. You will have deteriorated vision, spinal cord problems, sensations will be low, muscular problems, there will be malfunction in urinary control, digestive system, mouth and speech will be slurred, and then brain-related cognitive problems. So here you can see the damaged neuron, how the myelin sheaths are disrupted and damaged. So the damaged myelin sheath, they cross the nerve-blood barrier and then they go and settle in the cerebrospinal fluids. And that is why the CSF test indicated high levels of phospholipids. Now, for case 2, a baby is born normally. After 2 to 3 months, the mother starts observing that the baby's abdomen starts enlarging. After 5 to 6 months, the baby's abdomen has become significantly larger and unusual. At the same time, the mother noticed that the baby is not swallowing the food properly. She also observed that the baby is unable to perform motor skills. Upon taking to the doctor observed a cherry red spot in the baby's eye. The doctor had told there is no permanent cure for this condition and gave the baby few basic drugs to relieve the pain and discomfort. Unfortunately, after 18 months, the baby passed away. During the autopsy, they also found out that the liver and spleen of the baby has been significantly enlarged. What disease did the baby have? So the key points to note here is the swelling of the abdominal region. So, and when they did the autopsy, we could see that the liver and spleen has been swollen significantly. So the liver lies in the right upper quadrant and the spleen lies in the left upper quadrant. So both these quadrants of the abdomen were swollen. And other key points to note are the mother noticed that the baby was not able to swallow food. And she also noticed that the baby was not able to perform basic motor skills. So with all this being said, this is a type of sphingolipidosis. We must know the fact to come to this diagnosis. So this is Niemann-Pick disease, which is because of the absence of the enzyme sphingomyelinase A. Now, the proper answer for this is to decide whether if it is type A or type B. Now, our baby undergoes type A because the baby had large abdomen, cherry red spot, dysphagia, which is feeding difficulties, and then loss of early motor skills. And usually babies with Niemann-Pick type A, they do not live past 18 months of age. So this disease is Niemann-Pick's disease. Now, the final and simple easy case. If a patient is having the following results: acidosis due to low bicarbonate, low glomerular filtration rate due to high urea and creatinine, hyperglycemia due to high plasma glucose, ketosis due to high acetoacetate and beta hydroxybutyrate, and hyperkalemia due to high potassium. The patient is likely to have what condition and give at least 2 conditions. So here we can notice acidosis as the major one, acidosis, ketosis. So the patient is obviously undergoing diabetic ketoacidosis. Now that is an easy condition that we can tell from this case. But what is the other condition the patient might have? So for that, look at the second point, low GFR, low glomerular filtration rate. So there is a possibility that the diabetes mellitus has affected the kidneys and could have caused any renal disease to the patient. So the other condition that we would like to diagnose or assume before going any further into a diagnosis is any sort of renal disease. So diabetic ketoacidosis and renal disease. Here are some common symptoms of DKA, and that DKA is leading to a renal disease in this patient. Thank you.